Hi, I'm Dr.Pramod Chinder, orthopedic oncosurgeon, HCG and the ribbon. Today we will talk about giant cell tumor. ಅಂದರೆ giant cell tumor ಅಂತ ಒಂದು ಬೋನ್ ಟ್ಯೂಮರ್ ಇದೆ. ಅದ್ರ ಬಗ್ಗೆ ಮಾತಾಡೋಣ. ಯಾಕೆ ಅಂದರೆ ದಿಸ್ ಒನ್ ಆಫ್ ದ ಕಾಮನೆಸ್ಟ್ ಟ್ಯೂಮರ್ಸ್ ವಾಟ್ ವಿ ಸಿ. ಲೈಕ್ 100 ಬೋನ್ ಟ್ಯೂಮರ್ಸ್ ಇದ್ರೆ 90% ಆರ್ ಬಿನೈನ್ ಆರ್ ನಾಟ್ ಡೇಂಜರಸ್. Whereas 10 are dangerous if not treated correctly. ಬಿನೈನ್ 90% ಇದ್ದರೆ ಆ 90%ಅಲ್ಲಿ ಮೆಜಾರಿಟಿ ಆರ್ ಕಾಲ್ಡ್ ಜೈಂಟ್ ಸೆಲ್ ಟ್ಯೂಮರ್. ಈ ಜೈಂಟ್ ಸೆಲ್ ಟ್ಯೂಮರ್ ಅಂದರೆ ಯಾರಿಗೆ ಬರುತ್ತೆ? ಎಸೆನ್ಷಿಯಲಿ ಇದು ಬರೋದು ಆಲ್ಮೋಸ್ಟ್ ಯಂಗ್ ಅಡಲ್ಟ್ಸ್ ಅನ್ಬೋದು. ಅಂದರೆ ಆಲ್ಮೋಸ್ಟ್ ಲೈಕ್ 18-20ಇಂದ ಆಲ್ಮೋಸ್ಟ್ 30 ಇಯರ್ಸ್ ತನಕ ಕಾಮನ್ ಅದು. ನಾವು ವಿ ಮಸ್ಟ್ ಹ್ಯಾವ್ ಸೀನ್ ಅಬೌಟ್ 1,000+ giant cell tumors easily. Like in Nammo, we have handled about more than 8,000-9,000 bone tumors in a matter of 15 years. But definitely in this, we have handled about more than, I would say, 1,000. So giant cell tumor, ಯಾಕೆ ಇಂಪಾರ್ಟೆಂಟು? Because it comes in a very young adults and they are in the productive age population. Andre, they are either studying or they have just started their jobs, and they've just started their family. So this is kind of a difficult age. I mean, any age is difficult, but this age is quite a crux of a lifetime though. So that's what I always see them going through the problems. ಫಸ್ಟ್ ಆಫ್ ಆಲ್ ಒಂದ್ಸಲಿ ಇದನ್ನ ಹೇಗಾದರೂ ಫೈಂಡ್ ಔಟ್ ಆಯಿತು ಅಂದರೆ, ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ನೀ ಪೇನ್ ಬಂತು, MRI ಮಾಡಿದ್ರು ಅಥವಾ ಎಕ್ಸ್ರೇ ಮಾಡಿದ್ರು, ಯು ಫೌಂಡ್ ಔಟ್ ದರ್ ಇಸ್ ಎ ಟ್ಯೂಮರ್. ಮೈ ಹಾನೆಸ್ಟ್ ಸಜೆಷನ್ ಈಸ್ ಫಸ್ಟ್ ಬಿ ಕಾಮ್. ಏನು ಸಡನ್ನಾಗಿ ಗೂಗಲ್ ಸರ್ಚ್ ಮಾಡಿಬಿಟ್ಟು, ಐ ನೋ ಇಟ್ಸ್ ಕ್ವೈಟ್ ಡಿಫಿಕಲ್ಟ್, ಬಟ್ ಮೈ ಸಜೆಷನ್ ಈಸ್ ಓಕೆ, ಸಮಥಿಂಗ್ ಇಸ್ ಗಾನ್ ರಾಂಗ್, ಲೆಟ್ಸ್ ಸಾರ್ಟ್ ಇಟ್ ಔಟ್. ಹ್ಯಾವ್ ದಟ್ ಮೆಂಟಾಲಿಟಿ ಆ್ಯಂಡ್ ಗೆಟ್ ಇಟ್ ಕರೆಕ್ಟ್ಲಿ ವರ್ಕ್ಡ್ ಅಪ್. ಅಂದರೆ ವರ್ಕಪ್ ಅಂದರೆ ಗೆಟ್ ಇಟ್ ಅನ್ನೋದಕ್ಕಿಂತ ಯು ಮೀಟ್ ಆರ್ಥೋಪೆಡಿಕ್ ಆಂಕೋಸಿಸ್ಟ್ ಲೈಕ್ ಅವರ್ ಟೀಮ್ ಆರ್ ಮೀ. ಪ್ರಾಬ್ಲಮ್ ಹ್ಯಾಪನ್ಸ್ ಈಸ್ ವೆನ್ ದಿಸ್ ಇಸ್ ಕನ್ಸಿಡರ್ಡ್ ಆಸ್ ಎ ಬಿನೈನ್ ಆರ್ ಅ ಲೋ ಗ್ರೇಡ್ ಟ್ಯೂಮರ್ ಆರ್ ಅ ನಾಟ್ ಡೇಂಜರಸ್ ಟ್ಯೂಮರ್ and it is handled by a surgeon or somebody who is not doing it regularly. These things have to be done by a person who is doing it regularly, because the chances of it coming back is almost 100% or 90% if it is not handled by a person who is not doing the surgery regularly. ಅಂದರೆ ಈ ಸರ್ಜರಿ ರೆಗ್ಯುಲರಾಗಿ ಯಾರು ಮಾಡಲ್ಲ, ಅವ್ರು ಇದನ್ನು ಮಾಡೋಕ್ಕೆ ಹೋದರೆ ವಾಪಸ್ ಬರೋದು 100% ಖಚಿತ, ಬಿಕಾಸ್ ನಾವು ನೋಡಿದ್ದೀವಿ. ವೆರಸ್ ನಾವು ರೆಗ್ಯುಲರಾಗಿ ಇದನ್ನ ಹ್ಯಾಂಡಲ್ ಮಾಡಿರೋದ್ರಿಂದ ಸರ್ಜರಿ ಅಥವಾ ಎ ಟ್ರೀಟ್ಮೆಂಟ್ ವಾಟ್ ಎವರ್ ಇಟ್ ಇಸ್ ಟೋಟಲ್, ಚಾನ್ಸಸ್ ಆಫ್ ಕಮಿಂಗ್ ಬ್ಯಾಕ್ ಇಸ್ ಆಸ್ ಲೋ ಆಸ್ 10%. ಸೊ ದಟ್ ಈಸ್ ವಾಟ್ ಮೈ ಹಾನೆಸ್ಟ್ ಥಿಂಗ್ ಈಸ್, ಬಿ ಕಾಮ್, ವರ್ಕಪ್ ಮಾಡ್ಕೊಳ್ಳಿ, ಎಕ್ಸ್ರೇ ಮಾಡಿಸಿ, MRI ಮಾಡಿಸಿ, ನೀಡೆಡ್ ಬಿ ಪೆಟ್ ಸ್ಕ್ಯಾನ್ ಮಾಡಿಸಿ. ಲೇಟರ್ ಯು ಕಮ್ ಟು ಅ ಕನ್ಕ್ಲೂಷನ್, ಲೇಟರ್ ಯು ಮೀಟ್ ಆ್ಯಂಡ್ ಪ್ಲ್ಯಾನ್. ಮೋಸ್ಟ್ ಕಾಮನ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಫಾರ್ ದಿಸ್ ಥಿಂಗ್ ಈಸ್ ಸರ್ಜರಿ. ಈ ಸರ್ಜರಿ ಯಾವ ಟೈಮಲ್ಲಿ ಯಾವ ಜಾಗದಲ್ಲಿ ಅನ್ನೋದ ಮೇಲೆ ಡಿಪೆಂಡ್ ಆಗುತ್ತೆ. ಯಾವ ಫ್ರ್ಯಾಕ್ಚರ್ ಆಗಿದೆಯಾ, ಅದ್ರ ಜೊತೆಗೆ ಟ್ಯೂಮರೋಟಿಕ್ ಫ್ರ್ಯಾಕ್ಚರ್ ಇದೆಯಾ, ವಿಚ್ ಇಸ್ ಅನದರ್ ಕಾಮನ್ ಪ್ರಾಬ್ಲಮ್. ಲೈಕ್ ಎಸ್ಟರ್ಡೇ I met a teacher. She is very young, 28-29-year-old teacher, higher primary school teacher, government school, and newly wed. So it caused a lot of morbidity and operated by a surgeon who has not operated it regularly. So it has to be handled very delicately. ಇದು ಸರ್ಜರಿ ಒಂದೇ ಇಂಪಾರ್ಟೆಂಟ್ ಅಲ್ಲ, ಇದರಲ್ಲಿ ಫಾಲೋ ಅಪ್ಪು, ವೆದರ್ ಇಟ್ ನೀಡ್ಸ್ ಸಮ್ ಅಡ್ಜುವೆಂಟ್ ಡ್ರಗ್ಸ್, whether it needs other consultation like medical oncology ಅಥವಾ ಏನೋ radiologist. There are many other perspectives to it. ಅದಕ್ಕೆ this has to be handled by a team who handles it regularly. What are the other next problems? ಇದು ಕಾಮನ್ ಆಗಿ ಬರೋದು ನೀಯಲ್ಲಿ ಮತ್ತು ಶೋಲ್ಡ್ರಲ್ಲಿ, ಬಟ್ ಇಟ್ ಕ್ಯಾನ್ ಹ್ಯಾಪನ್ ಇನ್ ಹ್ಯಾಂಡ್ಸ್, feet and other bones. But when it happens in other bones, ಅಂದರೆ ಕೈಯಲ್ಲಿ ಅಥವಾ ಕಾಲಲ್ಲಿ, ಬೇರೆ ಪಾದದಲ್ಲಿ ಆದರೆ, that means it is quite aggressive. They behave a bit differently. So chances of recurrence is more. The chances of it going to lung are more. The chances of it being aggressive is more. Very rarely, like about 2 to 3% of these tumors can become cancerous or dangerous or sarcomatous. That has to be another word of caution. So this information is essentially for a fairly well a fairly well knowing person, ಅದೇ ಸ್ವಲ್ಪ ಗೊತ್ತಿರೋ ಇನ್ಫಾರ್ಮೇಶನ್ ಗೊತ್ತಾಗಬೇಕು ಆ ಥರದವರಿಗಿದು. ಸೊ ಒನ್ಸ್ ವಿ ಗೆಟ್ ಟು ನೋ ದಟ್ ಓಕೆ ಜೈಂಟ್ ಸೆಲ್ ಟ್ಯೂಮರ್ ಇದೆ, ಇದಕ್ಕೆ ವರ್ಕಪ್ ಆಗಿದೆ, ಇದೇನು ಮಾಡ್ಬೇಕು ನೆಕ್ಸ್ಟು ಅನ್ನುವಾಗ ವಿ ವಿಲ್ ಡೂ ಅ ಟ್ಯೂಮರ್ ಬೋರ್ಡ್ ಡಿಸ್ಕಷನ್. ನಾವೇ ಡಿಸ್ಕಸ್ ಮಾಡ್ತೀವಿ, ನಾವು ಡೈರೆಕ್ಟಾಗಿ ವಿಲ್ ನಾಟ್ ಜಂಪ್ ಇನ್ ಟು ಇಟ್. We discuss in detail, make sure that the best is given to the patient, not today or tomorrow or week. So we plan it for at least 2 years, 5 years, 10 years, 20 years down the lane. What would be the plan of action? Like these young adults, they have to continue their jobs. They cannot take up, they would have just started their jobs, they would have just started their dream. They should continue the working or continue riding a bike, motorbike, which is common in young boys. ಬೈಕ್ ಉಳಿಯೋದು ಬೇಡ ಅಂದ್ಬಿಟ್ರೆ ದೇ ವಿಲ್ ಬಿ ಲೈಕ್ ಅಯ್ಯೋ ಯಾಕೆ ಬೇಕು ಲೈಫ್ ಅನ್ಸ್ಬಿಡುತ್ತೆ ಎಷ್ಟೋ ಬೈಕರ್ಸಿಗೆ. ಐ ಮೀನ್ ಐ ಪರ್ಸ್ನಲಿ ಐ ಆಮ್ ಎ ಬೈಕರ್, ಐ ನೋ ದ ಪ್ರಾಬ್ಲಮ್. ಸೊ ಒನ್ ನಂಬರ್ ಟು, ಫೀಮೇಲ್ಸ್ ದೇ ವುಡ್ ಹವ್ ಜಸ್ಟ್ ಸ್ಟಾರ್ಟೆಡ್ ದ ಫ್ಯಾಮಿಲಿ. ಟ್ಯೂಮರ್ ಆಗಿದೆ, ಮಕ್ಕಳು ಮಾಡ್ಕೋಬೋದಾ? ಈ ಟ್ಯೂಮರ್ ಮುಂಚೆ ಇತ್ತು, ನಮ್ಮ ಮದುವೆಗಿಂತ ಮುಂಚೆ ಯಾಕೆ ಇರಲಿಲ್ಲ? ಫ್ಯಾಮಿಲಿ ಇಶ್ಯೂಸು ಇದೆಲ್ಲ ನಥಿಂಗ್ ಟು ಡೂ ವಿತ್ ಎನಿಬಡೀಸ್ ಫ್ಯಾಮಿಲಿ ಹಿಸ್ಟ್ರಿ ಆರ್ ಎನಿಥಿಂಗ್. ಇಟ್ ಕ್ಯಾನ್ ಹ್ಯಾಪನ್ ಟು ಎನಿಬಡಿ. Rest assured, we have to make sure we have to support that lady or a girl who has gone through this. So that's the motto number one. That's why I always tell you have to meet 5 of your best friends and 5 of your best family members before coming to me. So as I was telling, this is not your own problem. This is a problem of the family or the community, so which has to be combinedly handled. So and once this is diagnosed, lot of problems crop up. I will go to that problem, those things also. ಒಂದು ಫ್ಯಾಮಿಲಿಯಲ್ಲಿ ಹೇಳೋದು ಬೇಡ, ಡಿಸ್ಕಸ್ ಮಾಡೋದು ಬೇಡ ಅಂತ. ಎರಡನೇದು, ಅಫ್ಕೋರ್ಸ್ ಇಟ್ ಹ್ಯಾಸ್ ಟು ಬಿ ಡಿಸ್ಕಸ್ಡ್. ಸೊ ಇದು ಪ್ರಾಬ್ಲಮ್ ಆಗಿದೆ, ವಾಟ್ ಇಸ್ ದ ಬೆಸ್ಟ್ ವೇ ಟು ಸಾಲ್ವ್ ಇಟ್ ಅಂತ ಡಿಸ್ಕಷನ್ ಆಗಬೇಕು. ಆ್ಯಂಡ್ ನಂಬರ್ ಟು, ವೇ ಡು ವಿ ಸಿ ಇಟ್? ಸೊ ಇಟ್ ಹ್ಯಾಸ್ ಟು ಬಿ ಸೀನ್ ಬೈ ಎನ್ ಸ್ಪೆಷಲಿಸ್ಟ್. ದೇರ್ ಇಸ್ ನೋ ಕ್ವಶನ್ ಅಬೌಟ್ ಇಟ್. ಗೋ ಟು ನಿಯರೆಸ್ಟ್ ಡಾಕ್ಟರ್ ಅನ್ನೋದೇ ಇಲ್ಲ ನಾನು. ಇಂಡಿಯಾದಲ್ಲಿ ಅಥವಾ ಯಾವುದೇ ದೇಶದಲ್ಲಿ ರೈಟ್ ನಾವು ಇಂಟರ್ನೆಟ್ ಈಸ್ ಅಟ್ ಯುವರ್ ಫಿಂಗರ್ ಟಿಪ್ಸ್. ಯು ಫೈಂಡ್ ಔಟ್ ಹೂ ಹ್ಯಾಂಡಲ್ಸ್ ದಿಸ್. ಯೂಸ್ ಯುವರ್ ಬ್ರೈನ್. When you talk to your friends, they will help you out. Very important is that. Find out the right person and come here. Then, ಅದಾದ ನಂತರ, once you are in the right field and you know that what's happening, then comes one of the important thing is finances. Yes, many insurance cover it. Schemes, ಎಷ್ಟೋ ಜನ ಪಾಪ ಸ್ಕೀಮ್ಸಲ್ಲಿ ಇರ್ತಾರೆ. I'm sorry to say, most of the schemes do not work. Of course, they work. But if you want to really have a right, proper, world class, the best treatment, it's very difficult to do these things under any scheme. But yes, there are certain government schemes which will provide to one extent. We can do that. But these finances also can be planned. That means you discuss these problems with the doctor openly. Normally, I have a rule of third or rule of fourth, 20% or 50%. What we do is rule of 4 or 25%. If the patient cannot afford, and ಏನು ಪಾಪ ಅವ್ರ ಹತ್ರ ಏನೂ ಇಲ್ಲ ಅಂದರೆ, somehow with the help of themselves, savings ಎಲ್ಲ ಸೇರಿ ಒಂದು 25% ಅಫೋರ್ಡ್ ಮಾಡಿದರೆ, ಒಂದು 25% we are ready to help you out. ಇನ್ನೊಂದು 25% there are MP, MLA funds which are there, which you have to get it. There are there. ಎಷ್ಟೋ ಜನ ಹೇಳ್ಬೋದು ನಿಮಗೆ ಆಗಲ್ಲ, ಅಪ್ಲೈ ಆಗಲ್ಲ, your APL, BPL. Nothing like that. We are entitled to have it. Everybody should have it. We are taxpayers. We have, like, for example, a teacher. Why she can't be getting the fund from MP or MLA funds? It's our own money, right? I'm sure no MLA or no MP will give money from his pocket. Avdalva. So we have to get it, 20-25% from them. And 20-25% we have to raise some funds. You have to seek help. There are people who want to help. I have so many people who are keen on helping, but only thing problem is nobody asks for help. So it is nothing wrong in asking the help. My honest suggestion is when you are having a problem, seek for help. ಕೇಳಿ ಏನ್ ತಪ್ಪೇನಿಲ್ಲ ಪಕ್ಕದಲ್ಲಿ, but make sure that you don't put the whole family in trouble for your problem. ಅಂದ್ರೆ ಎಲ್ಲೋ ಸಾಲ ಮಾಡೋದು, ಎಷ್ಟೋ ಪರ್ಸೆಂಟೇಜ್ ತುಂಬ ಅದೇನೋ ಎಕ್ಸ್ಟ್ರಾ ಪರ್ಸೆಂಟೇಜ್ಗೆಲ್ಲ ಸಾಲ ಮಾಡಿಬಿಡೋದು, then the whole family will come to the roads. ಮಾಡಬೇಡಿ ದಯವಿಟ್ಟು. So there are ways to get funds without any interest. So ask your friends that I'll not pay interest. You give me, I'll give it to you a few months later. There's some methods sure to openly discuss. I'm sure the problems can be solved. See, all these things I'm telling you with my 15, 20 years of experience of handling all types of patients, from person who's having 0 rupees to person who's having crores of rupees. Means it is possible to handle every problem. So that if mentality if you have, and if you go ahead thinking that in 3 years time or in 5 years time I'll be having a degree, or I'm being a doctor. I'm sort of my patients are doctors, engineers now, or not only that, a couple of them are studying for IAS as well. So, and some of them politicians now. So what I mean to say is there is nothing which cannot be solved. Likewise, we will try to solve the medical problem of it to the world's best, and will help you in guiding you financially. ಅದಾದ್ಮೇಲೆ ಸರ್ಜರಿ ಇಸ್ ಅ ಮೇನ್ ಕೋರ್ಸ್ ಆಫ್ ಟ್ರೀಟ್ಮೆಂಟ್. ಸರ್ಜರಿ ಹೇಗೆ ಮಾಡೋದು, ವಾಟ್ ಇಸ್ ಇಟ್ ಇಸ್ ಅನದರ್ ಡೀಟೇಲ್ಡ್ ಸಬ್ಜೆಕ್ಟ್. ದಟ್ ಮೀನ್ಸ್ ಇಟ್ ಹ್ಯಾಸ್ ಟು ಬಿ ರಿಮೂವ್ಡ್ completely with an experienced surgeon. It cannot be handled by anybody who's less experienced or not experienced at all. ಒಂದು. ಎರಡನೇದು, ಫಾಲೋ ಅಪ್ ಆಫ್ಟರ್ ಸರ್ಜರಿ ಏನು ಮಾಡಬೇಕು, ವೆದರ್ surgery alone is finished or anything else you need. Yes. Nowadays, there is in 2024 or in the last 10 years, there's a new drug called Denosumab, which we have worked on it since the 10 years. We have published papers. We are presented in international conferences. And also we are told that it is not needed to give so much of a dose of drugs, which less dose is enough. So this drug is very, I really like this drug because it works pretty well. And how do we use it is very important. It cannot be, okay, injection ide ತಗೊಂಡ್ಬಿಡೋಣ. No. And injection ide ಕೊಟ್ಬಿಡೋಣ. ಎಷ್ಟೋ ಡಾಕ್ಟರ್ಸ್ ಇದ್ದಾರೆ. Oh, this is some new drug, we'll just give it. It will work for sure. But how long you have to give injection? When to stop it? Nobody knows. That's very important. Whom, what to give. Andre, no two oncology patients are same. You should have an evidence, and above that, you personalize treatment. That means you individualize it. That is called personalized care. In the future, with genetics and all, future ಅಲ್ಲ ಇವಾಗಲೇ ಇದೆ genetics ಎಲ್ಲ, we use it pretty regularly. Genetics, targeted drugs, immunotherapy, robotic surgery, 3D printing. So we have to make the best use of all these technologies and get the best out of it. Technology need not be expensive. So people have taken it wrong. Oh, hi-fi technology use ಮಾಡಿದ್ರೆ ಹಾಗೆಲ್ಲ ಏನೂ ಇಲ್ಲ. Only thing is all it needs is a discussion and how do we go about it. There are problems to solve. There are problems which can be solved. But make sure you take this very seriously, and at the same time, do not hurry up. No cancer is emergency. You have to make sure that you discuss this problem 1 time, 2 time, 10 times, doesn't matter, before hurrying up for a surgery or any treatment. And in such a scenario, sometimes you can ask second opinion, third opinion, fourth opinion. There is nothing wrong in that for you to understand. So with these things, I think giant cell tumors can be handled very effectively and have a very productive life for these young individuals. And they work ಮಾಡ್ತಾ ಇರ್ತಾರೆ ಅಥವಾ even laborers. I have a gentleman who does farming labor. For him, we have to plan something separate than a person who's doing a software engineer or a doctor. I have a doctor studying person. Now he's finished. He's become a doctor now. And for him, the way we managed is different. So it's very important to individualize these things. So with these things, I think we've discussed about giant cell tumor. If you have any thoughts, questions to ask, you can put it in comments in YouTube or mail to us. We have our website, theloriban.in, or you can contact if you get our number, WhatsApp us. And if uh, in any means, we are in Jayanagar, Bangalore, or in HCG, in Corporation Circle. So my team will be available at your disposal. Please come and discuss. We are all the way all ready to help you. So this is one of the mode which I think I wanted to pass on the information. So I've done it. Thank you for namaskara.